Welcome to the Presidential Panel, Data and Research Priorities in Federal Agencies, Visions for the Future. My name is Janet Lauritsen, and I'm honored to chair this special session that includes directors from 3 of the key federal agencies charged with improving the nation's understanding of violence and crime and informing government responses to these issues. Over the past several years, members of the ASC have not had much opportunity to hear from directors about the priorities of these important federal agencies or to be offered the opportunity to ask questions of them. Part of the reason, of course, was the COVID-19 epidemic and its effects on our meetings. But prior to that time, we also had an administration in place that was either disinterested, I can say this, disinterested or hostile to facts and research at many times. And these conditions create challenges for many agencies and for learning about their plans. So I view this session today as an opportunity to be brought up to date on the data and research priorities at the Centers for Disease Control and Prevention, the National Institute of Justice, and the Bureau of Justice Statistics. And I'm happy to report that all 3 of our participants were enthusiastic about doing so. I've asked each participant to spend about 20 minutes or thereabouts discussing their current priorities at their agency. And after all 3 are finished, members of the audience will have the opportunity to ask questions of the panel members. And there will be someone in the audience with a microphone. So if you'd please wait for that microphone to ask your questions, and I'll moderate that Q&A session. Okay. So our first panelist this evening is Dr. James A. Mercy. He's the Director of the Division of Violence Prevention in the Injury Center at the Centers for Disease Control and Prevention here in Atlanta. In his role as director, he provides leadership to innovative research and science-based programs to prevent violence and its consequences. So please welcome Director James Mercy.
Good afternoon, everybody. Great to be here. Thank you, Janet. I was thinking in preparation for this presentation that my first presentation at ASC was about 35 years ago, and I see Charles Welford in the audience because I think he organized a roundtable back then. But it made me think about how much things have changed in these 35 years. They've changed tremendously, of course. But back then, we had just a few routinely collected data sources available for research and to track patterns and trends in violence. Now we have many new data options and many on the horizon. Then we had very little evidence for effectiveness of policies and programs to prevent violence. Now the number of evidence-based policies and programs has greatly expanded. In the health world, 35 years ago, our hook was that violence caused physical injury. But now we understand that exposure to violence, particularly in childhood, can have impacts on brain development and get under the skin in other ways that affect the likelihood of mental illness, even chronic diseases such as cancer and heart disease over a life course. Back then, the words violence and prevention were rarely used in the same sentence. Now they're part of our lexicon in Congress, in the media, and even at meetings like this. So things have changed a lot. What I'd like to do today is to share 3 things with you in light of those changes and the evolution of the field of violence. I want to give you a brief description of the Division of Violence Prevention. I want to talk about our 3 strategic priorities. And for each of these priorities, I want to give you one example of a data system or innovation that we're working on and talk about some of the research priorities in these areas. So the Division of Violence Prevention at CDC. One thing to remember as I discuss our work is that we work at the interface between science and action. I mean, that's true of CDC in general, but it's important to remember that and what it means is that our data efforts are intended to be connected and to drive action. We call it data to action. Our research efforts are applied in nature. We want to know what works and what doesn't work in preventing violence. So as you think about, and as I talk about our work, just remember that's the niche that we work in, this science and data to action interface. We have about 170 staff members in the division. We have an annual budget of about $130 million. The best I'm able to tell, that the size of our staff makes us the largest organization in the world that focuses specifically on violence prevention. Our staff are made up of many different disciplines. We have behavioral and social scientists, including some criminologists. We have physicians and nurses, even a few lawyers. We address the full range of forms of violence, from child maltreatment to youth and community violence to sexual and intimate violence. We also do some global work. We've done violence against children surveys in about 25 countries around the world, but that comprises a very small part of our effort. So that's who we are and what we are in a nutshell. Now, what are our current priorities? We have three. One is reducing adverse childhood experiences. A second is expanding understanding of firearm injury prevention. And a third is expanding population exposure to evidence-based violence prevention strategies. So I'm going to discuss each one, and in each one give you an example of a data innovation that we're working on, and then also talk about the research priorities in each of those areas. So starting with reducing adverse childhood experiences. For those of you that know this literature, I mean, the main finding that's really been really important to our work is that the increased exposure to adversity, which is primarily includes violence and other types of household challenges, that the more of those that you're exposed to as a child, adolescent, or even young adult, the more likely you are to have mental health problems, physical health problems, a range of physical and mental health issues. And it really reflects how violence can get under the skin in terms, as I said earlier, influencing the structure of the brain, and also things like epigenetics even. The emerging research suggests that this type of exposure to this toxic stress for many children can actually change their DNA in important ways. So it's strategic from a public health standpoint, because if we can impact or reduce the accumulation of adverse childhood experiences, we can affect not just physical injury, but a whole range of health and social issues. So very strategic from our standpoint. It's also strategic, and I think it could help explain a lot of the disparities we see, particularly in race, in terms of health. Oftentimes, these disparities have been sustained over many years, decades, and understanding how exposure to these adversities is more likely to accumulate in disadvantaged environments may help us understand better the disparities we see in a range of health problems. One of the things that, if you know this literature, a lot of the research is based on adult samples. People have used, for example, a behavioral risk factor surveillance system to look at the prevalence of ACEs and their connection with different health outcomes. But while those data and those analyses are very important, they also don't tell us what's going on right now, right? If you're interviewing 30 or 40-year-olds that have experienced adversity, 20, 25 years ago, that doesn't really tell us a lot about what's happening now. So we're trying to integrate the measurement of adverse childhood experiences into the Youth Risk Behavior Survey, which is a survey of high school students that's CDC does in collaboration with departments of education across the country, giving that result in a national estimates as well as state level estimates of a variety of risk behaviors and conditions among youth. This will give us a much more proximate understanding of the prevalence of ACEs and also help us measure whether there be a sensitive measure to change over time. Some of the research priorities in ACEs are, first of all, refining the measurement definition of these. There's a lot of work that needs to be done on the measurement. If you know how people generally apply the ACE measure, they create a score of your exposure to a variety of these adverse childhood experiences. And they weight each one as a 1. And if you have 4 of these different types, you get a 4. If you have 2, you get a 2. It's a very crude estimate of exposure to adversity. There's also many types of adversity that aren't measured in the traditional ACE score. So there's a lot of work that needs to be done in understanding how better to measure this problem. Another research priority here is understanding positive childhood experiences. There's some early research suggesting that the positive childhood experiences can mitigate the impact of these adversities. And we need to know much better about understanding them. Things like connection to your school, to your family, the extent to which you have a positive adult role model in your life, or sort of positive experiences. But if we can better understand how these positive experiences influence youth and mitigate the effects of adversity, it would be greatly helpful in formulating appropriate prevention strategies. And finally, just understanding what works in preventing not just specific measures of adversity like child maltreatment, but the accumulation of adversity. We don't know a lot and haven't thought about how you reduce the accumulation of this adversity in populations. So that's a summary of our focus on adverse childhood experiences. Our second priority that I wanted to talk about was understanding firearm injury prevention. You all may know, some of you have followed funding in this area, that we were funding firearm injury research back in the late 80s and 90s, 1990s. And I'm not going to go into all the details, but essentially Congress removed that funding and transferred it to another issue at CDC. And for 25 years, we weren't able to do much in the area. Until a couple years ago, in fiscal year 2020, we got an appropriation of $12.5 million to focus on firearm injury research. NIH also got an appropriation of $12.5 million. We spend that appropriation about 80% funding R01 type research proposals, and about 20% strengthening data in this area. It's important to understand that we also address in our focus on firearm injury, suicide-related firearm fatalities and injuries, as well as unintentional or accidental injuries. So we address the whole gamut of ranges of firearm injuries that occur. Why is this a strategic priority? For obvious reasons. Firearms associated with the most severe outcomes associated with interpersonal violence and suicidal behavior. So it's a particularly important focus from a health standpoint. The data example I want to share with you highlights on a very important thing for us, and that's the timeliness of the data. Of course, as I said, we really work as this interface between data and science and action. And so the timeliness of data is very important. As you know, for many of our data systems, communities can't learn about what's going on in their community. The data is lagged by a year or more oftentimes. So we want to develop systems that can give us near real-time data as we can to help communities guide and know what's going on. I mean, firearm homicides increased by 35% from 2019 to 2020. So things can change rapidly. Very important to know what's going on now in any community or state. So we're piloting a system called FASTER. I think that stands for Firearm Surveillance Through Emergency Rooms. It's based on an enterprise system that CDC has called syndromic surveillance. Essentially, syndromic surveillance aggregates emergency room data across emergency departments across the country. Aggregates their electronic data. And the system was really originally built for the purpose of really being able to know what's going on very quickly with infectious disease outbreaks, and even for injuries and things associated with natural disaster. So we're piloting using this system to look at firearm injuries, to give us near real-time data to look at this dimension of the problem. The system currently includes more than 6,000 healthcare facilities covering 49 states and the District of Columbia. Within 24 hours of patient visits, data are available for analysis. Currently, 71% of the nation's emergency departments contribute data to this system, and there are over 6 million electronic health messages are received each day. So we're piloting this in 10 states and trying to see to what extent this system can be applied to firearms. One of the limitations of this system is it has very little information on the circumstances of the events. It also has a high degree of missingness on some key demographic variables such as race and ethnicity. And one way we're trying to explore whether that can be addressed is by seeing to what extent we can link other data systems to FASTER, to this syndromic data. Research priorities, so you know, we forecast 2 notice of funding opportunities for our firearm injury research for RO1 funding for during this coming fiscal year. Please look for that. We haven't announced them yet, but we forecast their availability publicly. And they really address 2 broad priorities. The first will focus on improving understanding of firearm injuries and informing the development of interventions. So it's really addressing a better understanding of risk and protective factors, across a range of types of firearm violence. But it's really to inform how we can develop appropriate policies and programs to address this problem. The second priority is actually the evaluation research priority to identify effective policies and programs designed to keep individuals, families, schools, communities safe from firearm injuries and deaths. Let me move to the last priority, and that's expanding population exposure to evidence-based prevention strategies. You know, the evidence base has exploded in what we know about preventing different types of violence. If you go to our webpage, if you search for Violence Prevention Technical Packages, CDC, we have a series of reports, compendiums of the best available evidence for different types of violence. So our priority, our goal, is to really expose a greater part of the population to that evidence base. We're known for data and we're known for research, but we're not so much known for our programmatic funding. But we fund programs across states and communities across the country. An example is our rape prevention education funding, which we give money out to every state to implement different types of strategies to prevent sexual violence. But the implementation and scale-up of these approaches to prevention that are most likely to work is a big priority for us. And don't get me wrong, we still need research to better understand what works and what doesn't work. We need more evidence, and we need to continue to emphasize and invest in that type of research. But I think implementation science is a very important focus for the future. A data example, I think we need to think about collecting data in this field of implementation the same way we think about it for our health outcomes or criminal justice outcomes. How many programs are out there? What kind of reach do they have? Who's being addressed? How have they been adapted? This is types of information, a data system that collecting is something we're beginning to develop. We're focusing on our grantees, but I think it's a type of data collection that needs to be expanded beyond that. it would be a goldmine for implementation research, and I think would help us really think about how we can more effectively and efficiently expand the application of the evidence base. Some of the research priorities I think are probably obvious, but how do we implement evidence-based programs with fidelity? How do we adapt programs that work in one context to other contexts? How do we scale up a program that can work in a few schools to a whole school system? These are really difficult challenges and questions we have. Even in the area of policy, how do we adapt, and what are the most essential components of specific policies or programs that really drive their effectiveness or their impact? Those are important questions it was a few years ago, it was hard to get good applications in the implementation science area. That's changing. I can see that in terms of the applications we receive, but very important for us. So in conclusion, while these are our primary strategic priorities, they do not encompass all that we do. Community violence is another area where we hope to greatly expand our work and build on the foundation provided by our work over many years in youth violence prevention. Targeted violence and online violence are two emerging areas that we hope to do more work in as well. One of my broader hopes is that we can find ways to increase productive collaboration and complementarity between public health and criminal justice in preventing violence, especially at the community level. Thank you so much for your time.
Thank you, Jim, for that interesting talk. Okay, our second panelist is Dr. Nancy Levine. She's Director of the National Institute of Justice in the Office of Justice Programs at the U.S. Department of Justice. As head of NIJ, she leads the Justice Department's research, technology, and evaluation agency, overseeing a wide array of social science research projects, technology initiatives, and forensic activities focused on improving public safety and ensuring the fairness and effectiveness of the justice system. I just welcome Director Nancy Levine.
Good afternoon, everybody. It's so great to see you all. Thanks for taking your lunch break and spending it with us in this dark room. It's not dark up here. I feel like a deer in the headlights, which is kind of how I felt when I started as director of NIJ in May of this year. I'm finally getting my footing, but it's certainly a great privilege and honor to be serving as NIJ director. And as you may not know, because Janet very wonderfully didn't go through my bio, which I always find painful to listen to, I'm no stranger to NIJ. I worked at NIJ a couple decades ago. I won't give you the exact date because I don't want to age myself. But I was there for 5 years, and then in my 6th year, I was in OJP supporting the Acting Assistant Attorney General. I was there under the leadership of Jeremy Travis, as well as Lori Robinson, who I see is in the front row here. Welcome, Lori. So it's a delight to be back in this very different role. I bring with it a pretty unique perspective for NIJ director. I have the perspective of having worked at NIJ and understood the grant-making process, how the vision is set, how priorities are implemented. And then during the couple decades after I left NIJ, I learned what it was like to submit proposals to NIJ, to win awards, and to make good on those commitments, which is not always easy to do. So I bring that perspective to you today, and I hope to promote a different kind of research. I'm sure you're eager to hear about my topical priorities. I will get to some of them later. But when I walked through the threshold of NIJ in May, I wanted to make sure that I didn't signal that I have favorite topics, because honestly, I don't. I mean, yes, I've spent most of my research career in the corrections and reentry area, as well as policing, But if you looked at my resume, you'd know that I'm interested in everything. This is why I didn't go into the academic community, because I wanted to dabble. I don't know that dabbling gets rewarded in the academic community, but it certainly does in the research institute environment. So I didn't want to signal that I had a priority of one research topic over the other, but I also thought it was important to emphasize how I feel that research should be conducted in ways that NIJ can promote changes in the research process. And so there's several priorities I'd like to go over with you today. I'm going to enumerate them now, and then I'll describe them in more detail. One is to promote inclusive research, to promote research that takes an equity lens in the research question, thinking about issues of equity. The third is to encourage multidisciplinary research teams. A fourth is to promote implementation science. And a fifth is to ensure that the evidence that we develop leads to action on the ground. Now, if these sound familiar to you, Jim and I met, maybe it's like my second month on the job, and compared notes. And I swear I did not crib off of CDC's website, but it's really interesting to note the alignment in vision and really quite validating. And I'm excited to call CDC a close partner of ours as we pursue research agendas, both topically and in the how the research gets conducted. All right, so let me just dig into a little bit more detail on what I mean by each of these concepts. So inclusive research is research that takes the time to hear from the people who are closest to the issue or problem under study. It could mean, on one end of the continuum, full-on community-based participatory research, which is important and growing in our field. And that is the type of research where you barely even have your research question articulated before you engage with the people who are experiencing that. And it's about partnering in every step of the process, equal partners in the research generation, the data collection, the analysis, the interpretation of findings. Okay, that's on one end of the continuum. A lot of people think about that as qualitative research, but it need not be qualitative. In fact, I'm a big fan of mixed methods, what I call numbers plus narratives. And when you combine the two, that's when research becomes really powerful and impactful. But on the other end of the continuum, even if your research is highly quantitative, even if you're primarily analyzing pre-existing data sets, I think it's important that you take the time to bring those findings back to the people who are the experts, who ultimately help generate that data. It could be practitioners. It could be people with lived experience in the justice system. Arguably, it should be both for most research questions under study. So that's something that NIJ will be promoting, prioritizing, and supporting in the future. Now, I mentioned this notion of an equity lens. Certainly, I think it's very important that if we are studying issues of crime and justice, we need to acknowledge and name straight out that the justice system in the U.S. cannot be disentangled with issues of disparities, racism, institutional biases, et cetera. It's all embedded in everything we do, every research question we explore, and the data sets that we use. And NIJ has a long history of supporting research specifically looking at racial disparities and ways to mitigate them, and we'll continue to do that. Last year, we brought back the W.E.B. Du Bois solicitation specific to those types of research inquiries. That, by the way, took a 4-year hiatus that happened to align with the last administration. And we're bringing that back this year as well. And I'm really pleased at that. But we can't have that be an isolated area of research. All research questions should be thinking about, where the disparities lie, how can we measure them, and how can we find ways to mitigate them. It could be program evaluation, where we take the time to see whether there's equal access to a program based on race or ethnicity or gender identity. It could be farther down in the findings and taking time to look at differential impacts on various populations. based on age, race, gender, et cetera. So there's a lot we can do, including interrogating our data and recognizing what it's measuring and what perhaps it isn't measuring, right? So we know arrest data has racial biases baked into it. But we hold it up as, being this truth about a measurement of crime. We know that race variables, we throw them in, we assume that they're measuring race, when we know they're measuring a lot of other factors, right? A lot of other unmeasured issues that relate to structural inequality. So I think it's very important that we promote research that takes an equity lens. I mentioned promoting multidisciplinary research teams. This is something I'm really keen on. I've noticed a lot of new disciplines entering our field. What can we say? It's a hot topic, right? Everybody now is, I want to study issues of crime and justice, and fantastic. The more, the merrier. They bring new methodologies, some quite innovative, but they don't necessarily bring an understanding of the data, what it's measuring, or the policy context. And so we can let them do their work in isolation and get published and end up in high-profile journals, or we can partner with them and ensure that that research is not making errors in data definitions and really understands what it's measuring. I can't resist telling a little story of a panel I was on not too long ago. I've got to be careful. No names, but it was an economist that was clearly new to the justice community that presented research that said that parental incarceration can be beneficial for kids. And so I'm like, yeah, the BS detector is going off really high. I mean, I know the research on that topic pretty well. And so I'm listening really closely. I'm like, what, how did he do this? What kind of data sources? And about halfway through, I realized that he didn't know the difference between jail and prison. I'm like, very high-profile university, et cetera. So, we can partner or we can let them produce research that looks really good on the surface but isn't accurate. So let's team up. I mentioned implementation science, something that Jim mentioned as well. That's really important to me. Evaluation, of course, is very important because we need to know what works, and we're still building that knowledge base. Now, my NIJ political director predecessor was big on randomized controlled trials, and yeah, those are terrific. But that's not the be-all and end-all, and not all research questions can be answered with experimental designs, which is why it's important to look at alternative methods that are rigorous. But even those rigorous methods are not enough if we don't have an implementation evaluation component to them. And I'm thinking back to when I led the What Works in Reentry Clearinghouse when I was at the Urban Institute, and we culled all of the research articles and found that very, very few made any mention of implementation fidelity. I mean, we all know that that's useless. And so then that your RCT that finds that something doesn't work, that's meaningless because you don't know why it doesn't work. Oh, let's just say that work release doesn't work. And, this is the most rigorous program, so now let's not do work release anymore. Well, maybe that program didn't reach the right population. Maybe there were interruptions in service delivery. There's a whole host of reasons to why things don't work that shouldn't result in, throwing out the baby with the bathwater and just deciding that, this whole concept is flawed. So that's something I feel very passionately about. And finally, and this, Jim, you are really going to think I cribbed off of this. It's what I'm calling evidence to action. It's not data to action, it's evidence to action. So when I look at the history of NIJ and even the field in general, we've spent a lot of time and made great strides and tremendous progress in making research more understandable to the people we're trying to reach, right? I mean, I had the benefit of working at NIJ with Jeremy Travis as director, and he was extremely sophisticated in thinking about communications and getting the research findings into the right hands. And I looked at John Laub, who really coined the term translational criminology, although others were using it. But that notion that we need to translate, that's part of our work, and it's a responsibility that we have. And we've done that at NIJ in many ways, and continue to do that through our flagship NIJ Journal, that is actually award-winning, and through social media, through our email communications, et cetera, et cetera. It's all great. But I'm not convinced that it is leading to changes on the ground. I mean, what do we know, really, about whether people are taking that information, using it, and changing the way that they approach their work? Very, very, very little, and we need to learn more. So that's our Evidence to Action initiative, and we're going to look at the science about evidence take-up that goes well beyond criminology. I'm thinking about communications and marketing, and there's a lot the field of medicine has learned, and public health, and you name it. So we're going to be digging into that, and also talking to a lot of the quote end users to hear how they learn about evidence, what they think about evidence, whether they're really learning about evidence or just learning about programs that someone who's charismatic says work, which we know happens a lot in the field. And ways that we can make more of a difference, because that's why we're all here, right? I mean, we're not just generating research for each other to read. I mean, we'd like for you to read it, because it's nice to get the citations. But what's more important is research that changes the world and makes it a more just and safe environment for all. So those are the priorities around how the research gets done. I said I don't have favorite topics, and maybe I don't. But we do have priorities for the coming year. And this is one of my public service announcements. Last year, we got crunched where we didn't have a lot of time to release our solicitations, which meant that you all, potential grantees, didn't have a lot of opportunity to develop and submit those proposals. This year, we want to make sure you have at least 90 days from the time of release to the deadline. That's great, but wait. There's more. The more part is that last week we posted a web page on our forthcoming FY23 solicitations. They're listed by title, and there's a brief description underneath them. Don't wait. Start now. Get your research partnerships lined up. Get your data sharing agreements in place. Start working on the proposals. They'll be better for it, and we'll have a better array of proposals to choose from, which is, of course, very important to us. I will tell you a little bit about what's on the website. We're certainly continuing our relationships with the Office of Violence Against Women, with the OJJDP, Office of Juvenile Justice Delinquency and Prevention, and the Office of Victims of Crime. Historically, they have transferred funds over to NIJ, and we have worked in partnership with their staff to develop those solicitations. Those will all be returning and covering topics like youth mentoring, victim services, elder abuse and fraud, violent crime, hate crimes, human trafficking. We'll also have some returning solicitations, one on school safety, one on domestic radicalization and violent extremism. The administration of justice solicitation will also be returned, but this year we're going to have more of a focus on public defenders and indigent defense in honor of the 60th anniversary of Gideon, which is very exciting. Yes, the policing solicitation will return. I'm calling it a mega policing solicitation because there's so much that we need to know about accountability mechanisms, training, et cetera. So that is forthcoming. It looks at issues of shifting police resources, a whole host of things. And then we have some new solicitations, or not so new. One is our Community Violence Intervention and Prevention Initiative. That was new last year. This is a huge investment on the part of the Office of Justice Programs in community-based violence intervention and prevention programs. And there is a research component that includes both evaluation of those programs as well as basic research that can inform efforts to reduce violence through community-based approaches. And we also will have our firearms solicitation that will I think about these two in tandem because they're so complementary. And that will also include a huge investment in extreme risk protective order research. We also have a new solicitation coming out on jails. Jails in relation to communities and vice versa, jail workforce issues. That was something we had hoped to do last year, but were unable to do owing to resource constraints. And we'll be doing a solicitation on resentencing to look at efforts to address exceedingly long sentences from the people who are serving them, and also one on correctional climate and culture. And a national longitudinal study examining interpersonal violence of young adults who are around college age. So a lot to look forward to. Of course, we also have our forensics solicitations that are less social science based, but there are opportunities for social science in those as well. Very exciting time for NIJ. We are growing. We are finally getting more staff after having shrunk considerably over the last 15 years, including by 25% during the last administration. Bear with us if we're not as responsive as you'd like us to be, and that's the reason why. We have fewer staff who are doing more work, and allow me to say that they are a phenomenal collection of experts. The science staff are top-notch, and our professional staff, same. I wasn't sure what I was going to return to, what kind of agency. I knew it was smaller, but I was so pleased to know that the quality has remained, and that's just so inspiring to me. I just want to close with a couple of public service announcements. One is that I'd really like to encourage people to sign up to be peer reviewers. Can I see a show of hands? How many have been a peer reviewer for NIJ? Oh, not enough. Thank you for your service, those who raised your hands. We need more of you. There's two reasons to do this. One, if you're an aspiring PI, you're early in your career, the best way ever to learn about what it takes to write a winning proposal. Now, if you're more senior or seasoned, shall we say, you might think, I don't have the time, and certainly the compensation isn't particularly good. But think about it as a service to the field the same way you would doing a review for a journal. It's really important that we have high-quality peer reviewers. We've really wrestled trying to get people last year. We'll make sure you don't have conflicts with anything you've submitted, but I really encourage you. If you're on Twitter, I did tweet out the link to how to sign up, so check it out. And that was only a few hours ago, so it should be easy to find. The other thing I wanted to share, and this is super exciting for NIJ staff, and I hope it is for you as well, is that we're bringing back the NIJ Research Conference. Do you all remember that one? It's been over 10 years. I'm so excited. Save the dates, May 23rd through 25th. It's in the DC area. We'll be featuring our grantees, primarily those who have findings in hand that they can share. We're going to welcome lots of practitioners and policymakers, and I'm just very much looking forward to that. And then I also wanted to share that tomorrow at 11 a.m. we have something that I think is a first for ASC. We have a panel that features several heads of OJP agencies. We'll have the President's nominee for Assistant Attorney General over the Office of Justice Programs, Amy Solomon, myself, Alex Picaro. We'll have Chris Rose, who's the head of the Office of Victims of Crime. We'll have Liz Ryan, who's head of OJJDP. We'll all be sharing very short versions of our priorities because we want to leave time for you. We're thinking about this as a listening session. Please think about coming and tell your friends and colleagues. This was a late edition. I thank you, Janet, for accommodating us. It is a first to have that level of representation, and we like to think that it's our way of conveying how much we care about this community and the value of evidence. So thank you so much.
Thank you, Nancy. Okay, our third panelist this evening is Dr. Alex Picaro. He's Director of the Bureau of Justice Statistics in the Office of Justice Programs at the U.S. Department of Justice. As head of BJS, he establishes the agency's objectives, guided by the needs of the field and the priorities of the U.S. Department of Justice. So please welcome Director Alex Picaro.
Hi, everybody. As Nancy said, thanks very much for giving up your lunch hour, or if you ate earlier. I know you have many choices in air travel, so thank you for traveling this airline today. This is a huge honor, but an even bigger honor for me was getting a phone call asking me if I'd be willing to serve as the director of BJS some months ago. And as the son of two Cuban political refugees who came to this country with nothing, it was like, oh my gosh, my parents would be so proud. And so I wouldn't be anywhere in my life without all the sacrifices they made, so I have to make sure I say that. As an academic, I always looked at BJS and NIJ and CDC as a user and as a consumer of the data and the PDFs. So they used to be paper products we used to get in the mail when we got mail. And I remember how much it was important to me. And I used those data sets, and I applied for funding, got rejected, and got a couple. And it was so important to me. And I remember when I was approved and got the commission to serve by the president, that I didn't want to screw it up, but I wanted to make it relevant. And BJS is one of 13 of federal statistical agencies. It should be the go-to place for anything we want to do and study with respect to crime and justice data broadly defined. And so when I did some history and asking around about the history of BJS, it always comes down to the person who chaired the department where I went to grad school, Charles Welford, who was involved in some of the early plannings of a justice statistics agency. And so I thought, I can't for sure screw this up, because then he would get really upset. So it's an even bigger honor because of his history with the original planning of this. And so when I thought about what I wanted to do with BJS, I reached out to Nancy, because that's what I did, and that's what she told me to do. And she goes, you really need to think about your priorities. I'm like, oh, do I got to come up with a list of 3 or 4? I'm not going to be that guy who comes up with a list. And here I am, I'm a guy who comes up with a list. But the most important thing is it's what's in BJS's 1979 charter. Timely, relevant, credible, and accessible. That's what we need, and that's what we should have. And I think Jim said the exact same thing. So the first thing I did from before day one was I said, we need to modernize BJS. And steps had already been taken to do that. Web pages are like athletics is the centerpiece of a university, whether we like it or not. A web page is the centerpiece of a domain. And so BJS now has a nicer web page. We have cool data visualizations on those web pages. There's one for the NCVS. There's one called Learcat, so the cat roars for NIBRS. And there's another one coming out on justice statistics, which talks about expenditures. And because the rest of the world is using visualizations, we needed to visualize. And so that's one step in that direction. We are moving towards a web-first publishing. So rather than waiting months and weeks to get a report, like all of us waited months and weeks to get a report, we got to get stuff in and get stuff out, because the world is operating like this, and we have to meet the world there. And so one of the first things I did was I created a new series, and I let Team BJS have its own contest of what they would like this new series to come up. So I'm an ideas guy, so the idea was great. Putting it into action is a little bit more complicated. But the idea was we're going to do one-page reports. So in one page, I can see a figure or a table and 3 paragraphs. And so I see the title of the study, and I see the figure in the table, and boom, there's the answer. And in 30 seconds, I know. If you want to read all the robust standard errors, because it turned into 4 pages, because the first ones were a bunch of statisticians, they're in the appendices. But I wanted to get stuff out quicker. And so what I did is not only that the team came up with the names called Just the Stats, and our first one was on carjacking, and within a week we had 2,000 people subscribe to this. And we have 3 more coming out. And I let the team, you all decide what you want to do. Because the BJS I grew up, my mentor was late Ray Paternoster. His wife was a woman named Ronette Bachman, who started a career at the Bureau of Justice Statistics. And a lot of the work that they were doing then was not just BJS's work, but their own research. I want Team BJS to do the stuff they want to do. They're statisticians. They're professionals. Let them create. And this is one avenue that they can choose to create. So the more we're going to get those things out, there's 3 more in the pipeline, the more the merrier. And we're releasing reports left and right, which is great because we deserve those reports. And there's a really important one coming out tomorrow. So I'll just say that, 10 a.m. That's all I can say right now. That's all I can say. It's like Ticketmaster or Taylor Swift tickets, but I promise, please break down the BGS website. That's okay. Don't quote me on that. Some people got that in the room. So we need to modernize. And so, because the rest of the world is modernizing the way they do crime statistics and releases, and so we need to do the same thing. The second thing I want to do is engage. And I think one of the things, I think Nancy and I share this extremely well, and in many ways we think a lot alike, with respect to engaging the world about what we do. We need to be front and center, talking to anybody and everybody about what we do and why it matters for them. I remember being on the NAS Modernizing Crime Statistics panel that was co-chaired by President Janet Lauritsen. And I remember saying in that meeting, several meetings at the great building on Constitution Avenue, the National Academy of Sciences, I said different people need different data in different ways for different reasons. So when I communicate to the academic world, it's going to be a 35-page article. There's going to be 25 tables. There's going to be 19 appendices and 19 tables because every reviewer wants this, that, and the other. My mom's never going to read that. My neighbor's never going to read that. And I remember, when I briefed on Capitol Hill, I remember one late senator, not to be named because we're not allowed to name names, told me once, Alex, if it has a staple or a paperclip, no one's going to read it. And it was tongue-in-cheek. But it followed me throughout a lot of my careers. You have to get people information in a ways that are relevant to them. So we at Team BJS are engaging. We do stakeholder briefings like there's no tomorrow. And it's not just Alex doing stakeholder briefings. I want everybody doing those stakeholder briefings. So anytime we brief staffers or people on the Hill or nonprofits or whoever we can talk to, we will talk to, assuming we're allowed to talk to them, we will talk to them. And that's what we got to do. My job is to make BJS visible to the world and accessible. And I remember in terms of, in the academic world of mine, when I do a lot of media stuff, I remember one reporter told me, your best ability is your accessibility. And so at BJS, we have to be accessible to people. We need to make sure that they get what they need in purposes that are relevant to them, that are useful for their information, decision-making, and so forth. The third thing I want to do is elevate the people in BJS. One of the great things about being an academic is mentoring students, undergrads and grads, and I see a bunch of them in the room today. It's the best, it's the most rewarding part of the academic job. And so I want to do the same kinds of things in BJS. And so one of the first things I did was I want to meet with everybody. I'm meeting with a lot of people in boxes on screens, but that's the world we're all in, but that's okay. Now, a lot of people still, we meet in the office, and that's cool too. In fact, we came up with a planning with the Winter Wonder Council for our holiday party that's happening in a few weeks. The council members are here in the audience. But the idea is to meet people, is I want to meet them, I want them to meet me. And I ask them, what do you see that's good? What do you see that's bad? What do you want to do? What do you not want to do? What should we do that we aren't doing now? Because you know what? We can do it. Let's just do it. And let's just do things that we haven't done before, because there's no reason why we can't do things that we haven't done before. So we're initiating new data collections that are going to be coming out this year. And we're setting positions in place for, hey, sometimes people don't know when they should be a leader. And sometimes they got to be told, you might want to think about this in your career. So part of this meeting with people is kind of see what is that they want to do and try to find a way for them forward. Because as a director of a statistical agency, a big task of mine is professional development. It's actually written in part of our guidelines as directors of statistical agencies. So I want to make sure I can help them, but I need their help to help me help them. So that's number 3, is elevating. Number 4 is cooperation and engagement with other people. Right away, I think even before I was officially started, Nancy and I wrote an op-ed for the Tampa Bay Times on school safety. And that's one way to reach another audience. And we integrated BJS data, NCES data, NIJ data, all kinds of stuff into a very accessible format. I'm also working with JJ, OVC, and soon BJA on some of the one-pagers that I talked about earlier. We're working with the Pardons Office in the government about doing some studies with them, with the Veterans Affairs about doing studies with them. All of these things are in the pipeline, and if we don't collaborate across the agencies, it's not going to work out very well in the long run. Two other things on engagement with partners. One of the things I found out about being the director of BJS was when the Evidence Act was passed, I automatically am the statistical official for the Department of Justice. So that's an extra job that I didn't realize I was going to have. But it's a huge opportunity, even though it's some challenges, a huge opportunity because now I serve as a resource for the entire DOJ. So I'm working closely with the DAG's office on some initiatives that we're not allowed to discuss, but that's really good because I can use our skill sets to help them answer important questions that they may not have been able to answer before. I'm also part of the Interagency Statistical Council on Policy, where I work with the other statistical agencies and directors in the federal government, the Census Bureau, labor statistics, as well as working with the chief statistician of the U.S. In terms of criminal justice data standards. So these things are part of executive orders that get into play, and when we carry them out, because that's what we got to do, as we find out. But it's a great opportunity to make BGS, its tentacles kind of go all over the place because of the kinds of research questions we're all interested in this world that link different data sources across the federal government. So it's a really great place to still be active in doing research, but also trying to move the needle a little bit. So when I'm out of this position, someone will say, hey, yeah, okay, you really weren't doing anything. You were really doing something. It just shows up 5 years later. So with that, I'll say it's a real honor to be part of this overall team, because I don't think it's just CDC or NIJ or BJA and BJS. I think all of us are trying to do as best as we can to bring data, evidence, research to improve the human condition. I think that's what all of us in this room are designed to do in terms of why we're in this space, and hopefully we can be a part of it. And if we're not being a part of it, we need to know what we need to do or to try and do to be part of it. I can promise you it won't be tomorrow because things move a little bit slower, but they will move, and we do listen. So thank you very much for your time today.
I'm going to get this on. Okay, no. Thank you. Okay, so thank you, Alex, for that presentation. And so now it's time for audience questions, and we will have someone, I got to get out of this light. Someone has a microphone to bring to you. If you raise your hand, we'll get a microphone to you, and you can ask questions of any of our panelists. So who'd like to start? Oh, come on.
I'll start.
Thank you. We'll get a microphone to you.
I think I'm good without a microphone. Okay. I'll just yell. Can you hear me? Do you all have updates on what's happening with the Access to Justice office?
Yeah, sure. It exists. It's thriving. It's got great leadership. Director Rachel Rossi is the head of that. And we're teamed up, NIJ and the Access to Justice Office, in collaboration around filling new gaps in research that they've identified. They're doing great.
Anybody else? Yes. So we don't have a microphone out there that yet? Okay. Well, we'll try to hear.
I have a question for Director Carroll about the NCPS.
Yes.
The rate of violent victimization is about half of where it was 3 years ago. Has there been any discussion about what might cause that? Is it just the way the samples collected? Is it COVID?
So it's always easy to blame COVID for everything, because that's what we all have done for the last 2.5 years. You know, as someone who likes to look at trends, I like to look a little bit more, because the last, what happened there? That wasn't just me. I want to see a few more years of that. You know, so that's what my answer to that is. I want to see a few more years of that, and also to dissect within the overall trend, because as we know, not just within official records, but also within the victimization surveys, crime type matters differently over the last 3 years. So for me, the jury's still out on why the last looks like that.
Next question? Yes. I don't know. Oh,
I can just ask you the question.
okay, now I'll repeat it, yeah.
For Dr. Mercy.
Oh, here we go.
I was excited to hear about, that you're piloting the FASTER data system. And I'm wondering, is there a timeline under which you expect that to be available for research and evaluation purposes?
Well, our hope is to be able to, based on the pilot, we've been piloting for about 2 years now, to be able to expand it beyond the original 10 sites. But our ability to depends on further funding. So these type of syndromic data, I don't know what the plans are for CDC to make them more generally available, but our intent is to hopefully be able to expand the system to more sites and to make the data readily available. But it depends on future funding.
Any hands up? We have a question back there.
Hi, thank you all so much. And one of the things that I thought was great was the amount of communication and collaboration that the three of you have within your agencies, and particularly informal collaboration. My question is there a plan for more formal collaboration across agencies, including other agencies that you discussed? And is there any, layout of how that might be communicated?
Okay, looks like I'm it. Thanks, guys. We have many formal partnerships with different federal agencies, both research agencies and other agencies, memoranda of understanding with them, some that involve the exchange of resources, dollars, others that are more codifying collaborations. So there's a lot of that's been going on for years. It ebbs and flows a little bit with different administrations. It's certainly a priority for me. And again, to harken back to my early days at NIJ, I watched Jeremy Travis grow the research investments of NIJ through those types of partnerships. So I'm looking forward to doing the same.
I think it's a terribly important question. We, as Nancy was talking and relating how we share many of the same priorities, we need to learn from each other. We don't need to be duplicating each other, but complementing and learning from each other. So the way we do that is by collaborating and talking. We've had, over the years, this collaboration between public health and justice has ebbed and flowed, depending on the administration, for sure. But I'm hoping in the future we can make it more consistent and steady in the way we work together. So, good question.
We do a lot with a lot of statistical agencies, and there's more coming. There's a big push in the federal government to make these easier. There's a tension between confidentiality and ease of accessibility. And so we're in the middle, all of us are in the middle of making sure that confidentiality protections are paramount, but also increasing the availability and ease of sharing data to answer questions. So for example, one of the things I did about a month ago is we used to have a section called Recidivism and Special Projects. So I changed the name to Reentry, Recidivism, and Special Projects. And I thought that was important to also focus on the positive part of reentry. And we can debate about whether there should be a hyphen there or not. And so we've decided no hyphen. It's a long conversation for another day, because that's the way things roll. But the questions about reentry involve employment, education, lots of other agencies that have data in this space. And the key is identifying, but protecting.
Okay, I see a question out there.
Hi. Oh, it is working. Great. Sarah Chu from the Innocence Project. Director Picaro, in the last administration, there were a number of BJS studies that were stalled or have vaporized somehow. And so how do we follow up on those past studies? Are there chances for some of them to be resuscitated? Yeah. Or what would it take for us to express interest in having those reinvigorated?
So prior to the interim director, the prior administration, the 4-year prior to the last 18 months before me. So there's a 4-year, and then there's an 18-month, and there's me. In, I think, the last 18 months, there were 64 reports released, and tons of different data sources that have gone up to NACJD for curation, and then that's a time-consuming process that we don't control after it leaves us. And so I think since I've been in office for 3 months and some days, not that I'm counting, we have released, I think, over a dozen reports, and there are at least 3 more in the pipeline. So there was a backlog that the interim and myself inherited, and they are going out in rapid-fire succession. We also had 2 years of, let's blame COVID, of data collection basically stopped for all of us in the world. And we're gearing back all of those, especially this coming year, after having signed all the different kinds of agreements we're doing. So there was a gap, but we're doing, I mean, the team works like crazy to get this stuff out there as quick as possible. They probably are upset at me about telling them we got to get this stuff out immediately. And so literally, I think it's every week we've had something coming out in the last month and a half.
Other questions? In the back there.
This question is for Director Picaro. Has there been any conversation with BJS and the FBI regarding network data quality reporting or anything along those lines?
Yes. So there are several of my experts in the room on this, and I'm happy to let them speak if they want to. But I'll say this. I started on Monday, August 15th, which was a couple of months before the data were released. We had weekly discussions with the FBI on various matters. Now remember, the FBI decided to sunset summary, and the ship sailed. I think in 2015, BJS started NCSX, and before that there was work with FBI and lots of other people trying to transition to NIBRs, which is, when it's all at 100%, it's going to be great because of the level of detail we're going to have. Remember, there was still estimation, even with summary reporting system. The issue is we had so many people reporting that the estimation wasn't as the confidence intervals weren't as much needed as they are, for example, for now. I think that what BJS did in the last 7 years of assisting local departments has been incredible. I mean, I just last night listening to the stories of 2 of my team members who worked with 2 agencies, and the amount of time and technical assistance and resources that the agencies have to transition, RMS systems, training personnel. Remember, the FBI controls that entire data collection. And so the discussions are, we keep working, and we keep working over and over again, not just with CGIS, the statistics folks in the FBI, but also with local police departments to transition. All 50 states are NIBRS compliant, so that's good. We just got to keep doing what we can to get the big agencies and bigger agencies on board. And some are, and some are transitioning that direction. We just got to keep at it. I'm hopeful that in the next few years, we're going to be better than we're at now. I suspect from what I've seen in terms of preliminary numbers coming in with reporting. We just got to hope that they keep going that direction. But, as someone, I started my first career at Temple University in 1996. I remember Jack Green, who was on the faculty there. He took me to the Roundhouse, which is the City of Philadelphia Police Department. At that time, Chief John Timoney was the chief of police in Philadelphia. And I remember going there to a meeting and talking about your data collection system, and it's on paper. So remember, we're dealing as statistical agencies or in the FBI, we're dealing with whatever the agencies have at their disposal, the dollars and the people power that they have at their disposal. So there's not much we can directly control in that, as much as we can to give them assistance and the support to make them go in that direction.
Okay. Any other questions? Well, I'm going to take an opportunity while the microphone comes to you. I know what one of the issues for all civil service agencies is personnel and being short-staffed. And I wonder, Nancy, you had mentioned you're down a certain percentage. Is there many signs of restoring the agencies, both all of you? I'm not sure you're understaffed, but I know BJS and NIJ are. But any evidence that that restoration is going to happen?
It is happening as I speak. We have had several positions posted. If you're interested in contemplating a career with NIJ or BJS or CDC, go to USA Jobs. You can sign up and then request alerts for agencies and positions of interest. The challenge is it's a long process. So, we post the position, it's up for a few weeks, people apply, and then successful candidates probably won't get their foot in the door for 4 or 5, 6 months sometimes. So that's the frustrating part. But the good news is we've been allocated new positions to help just fill the gaps. When NIJ shrunk, it shrunk by attrition. So people would leave and they'd take that position off the org chart. So we're really, struggling to rebuild. And there's some very positive signs that we'll be getting additional positions once Congress passes the FY23 budget, which I hope is soon.
Yeah, we are short-staffed as well. And part of the problem is we keep getting assigned sort of unfunded mandates to do additional work in all sorts of areas, and we just can't keep up with it in terms of our staffing. So our staffing also depends on funding increases that allow us to hire staff to address the many priorities that this administration has for addressing violence and crime, of course.
Yeah, other than to say is yes, and Nancy and I at least, we report to Amy Solomon, who's the biggest champion I think I've ever seen, who argues for us every single day, because she argues for her agency, OJP, all the time. And I know we have things coming, and we're growing, and we need to be much bigger than where we're at, given the level of work that the team does and gets asked to do over and over again. For the faculty in the room, you know exactly what that's like.
Thank you. Okay, so there was a question back here.
Thanks. And this is primarily for BJS and CDC, but I was wondering if you have any sense as to the degree to which your reliance on getting data from state and local units of government has been strained over the last 6 years in terms of some units of government not being interested or willing to provide data.
Alex may be able to better address that. I know it's an issue. I know in some of our data systems, like I mentioned the Youth Risk Behavior Survey, that certain questions on that type of survey, some states are unwilling to include in their surveys around sexual issues, for example. But we depend so heavily on the data from the states and localities for many of our systems. And so it's a great question and important issue.
One of the great things about BJS is that the statisticians have such great relationships with the local and state agencies that populate our data sets. And as you all know, relationships are very important in getting these kinds of things done. So in my mind, from what I've seen, we're more good than not good in that respect.
Okay, we got time for about 1 or 2 more questions. Anybody else? Okay, it's the last chance. All right. Well, help me thank the panelists for coming and talking to you. Really appreciate it.